Understandably, you will have questions concerning what you can expect after surgery. We will take you through the possible issues you may encounter after having had surgery and the do's and don'ts after the procedure. It is very important that you take it easy after surgery, but gentle exercise is healthy. If you do overdo it, you will be sore. Take your painkillers regularly after surgery. They need to be taken by the clock, whether you are in pain or not. You may not be in pain after surgery because of the medication you received during the procedure. Professor Obermeyer's practice nurse will be in contact with you to see how you're going after the surgery. She will check your organ functions and pain levels. A follow-up appointment will also be arranged. A follow-up appointment should be arranged 1 to 2 weeks after a laparoscopic procedure and 4 to 6 weeks after a laparotomy. If you have not received a follow-up appointment yet, please contact Professor Obermeyer's practice on 07 3847 3033 between 8:30 a.m. and 4:30 p.m. weekdays. If you had periods prior to your surgery and if both your ovaries had to be removed during the procedure, you will become menopausal. This means that hormone production from the ovaries and hormone levels will drop immediately, and menopausal symptoms could develop. You may wish to try hormone replacement therapy, which is often administered as daily tablets. If you were menopausal before the surgery, your hormone levels will not change and no further medication will be required. If emptying your bladder causes a burning sensation, please see your nearest GP for a urine test and antibiotic medication. You may have acquired a urinary tract infection. For weeks to months, your bowel function could be impaired as a result of your recent surgery. Try to add more natural fibre and yogurt into your diet first, rather than taking laxatives. As a sign of wound healing, a slight vaginal discharge is normal for up to 6 weeks and can even be blood-stained. Although, should your discharge become smelly, please contact your nearest GP, who will prescribe antibiotics for presumed local infection. You won't be able to fly for up to 4 weeks after surgery. All airlines will require a certificate clearing you to fly. Please contact the practice manager at Professor Obermeyer's clinic on 07 3847 3033 for a certificate. Why you could be fit for driving after your operation medically. In the case of an accident, your insurance could question your fitness to drive and if you're in pain or on medication. Please commence driving once you are pain-free and do not require analgesics anymore. Clean water is good for the surgical wound and does not cause harm. It's recommended to not use soaps or creams into the wound, as this could cause an infection. You may use creams again once the wound has completely healed. It's recommended to abstain from sexual intercourse, swimming or a full bath for 4 to 6 weeks after your surgery. Otherwise, the vagina could become infected and you might require antibiotic treatment. The sutures used for your operation will hold all structures together regardless of lifting, straining or exercise. However, if you do overdo it, you will begin to feel sore. You will find out by yourself how much physical exercise you can tolerate in the weeks following your surgery. The amount of exercise you can do will increase with time. Regular exercise is very important for your health and is recommended that you return to your usual routines as soon as possible. This is also similar for physical housework. If you had a hysterectomy for a cancer or pre-cancer, Professor Obermeyer will advise you on pap smears for the future. If you had a hysterectomy for benign reasons, you will not need pap smears any longer. The time needed off work will be determined by the type of work you do, whether it be office or manual, and the urgency of your return to your workplace. Please discuss your needs for a sickness certificate with the clinic's practice manager. The sutures used during your procedure are the type that don't need to be removed. However, these sutures could slightly stick out of the skin for a couple of weeks. They will become loose and finally fall off by themselves. If the wound site becomes red and sore, please contact the clinic, your GP or the nearest emergency department. Wound swabs need to be taken and you may require antibiotic tablets to treat a local infection. Should you feel unwell after being discharged from hospital, please contact Professor Obermeyer's clinic on 07 3847 3033 or after hours on 07 3830 5824, regardless whether you had surgery at Greenslopes or outside Brisbane. If there are problems, Professor Obermeyer would like to be informed first.